I am Dr. Praneeth Suryadevara, Interventional Cardiologist working in Spashta Healthcare. What is blood pressure? Blood pressure is the force exerted by the blood into the arteries that will push arteries outside. We will measure the blood pressure mostly by the help of a sphygmomanometer that will be measured in the form of millimeters of mercury. Normal blood pressure will range between 100 to 140 in a normal people. Once our age progresses, slowly our arteries will become stiffer and our blood pressure goes up. Majority of the times blood pressure is asymptomatic and it will be identified only when one complication happens. What will happen if our blood pressure is extremely high? If our blood pressure is consistently higher than the normal value, it start affecting the various organ. It can affect the brain, it can affect our eyes, it can affect our heart, or it can affect our kidneys, or it can affect the blood vessels of our legs. It will lead to various complications. So we have to identify this blood pressure much earlier and we have to treat it accordingly. So how to identify the blood pressure? Most simple way of identifying blood pressure is we should get it checked. If we don't check it, we can never identify that we have a high blood pressure. Once we identify whether we have blood pressure, then we should start treating it. How we will treat it? Either we can treat it with a lifestyle changes, that is in the form of salt restriction or good amount of exercise or having adequate sleep and stress free life. Second, if it is not controlled with all these lifestyle changes, then we have to go for medications. There are multiple medicines which are suitable for each person, so we have to select those things and we'll start using various medicines. And sometimes these high blood pressures can have a reversible cause, like blockages of the blood vessels which will supply the kidney. So if you treat those blockages, then this hypertension goes off. So we have to check for all these things. Even after doing all these things, some people will have resistant hypertension. That means even after doing all lifestyle changes and multiple medicines, then people still will have high blood pressure. That time we can do certain interventions called renal denervation therapy that will treat the blood pressure and will lead to reduction of blood pressure even with the medicines at least. So these are the various options that are available for the treatment of the high blood pressure. That the most important one is we have to screen each and every person from much younger age to have the high blood pressure such that we can prevent complications. Thank you.